Hey guys, Dr. Scranton here. I just want to do a little demonstration and clear up some misconceptions about plantar fasciitis. This is a condition that we can treat fantastically well and charge a very good fee for our patients to help them get relief with this. Because typically what they're doing, rolling their feet on golf balls, doing stretches, grabbing rubber bands to pull their toes up to their head, only provide relief for about the amount of time that they're doing it. The real problem when people have plantar fasciitis is not the bone spurs that are being caused in the bottom of their feet. They'll often point to or bring in x-rays because their medical doctors have told them that that's what's causing their problem. It's not what's causing their problem. That's just a reaction to the problem that they're having. No different than inflammation is not a disease. You can't catch it from somebody else. It just is an inflammation of the joint because the joint is being irritated and becoming inflamed. And so with plantar fasciitis, what's typically happened to this person is at some point they've rolled their ankle laterally, and so this bone is rolled underneath them, and that causes this cuboid bone to kind of shoot out the side of their ankle, and it causes the talus bone to counter rotate this direction, and all three of these bones get locked and stuck, what we would call subluxated. They're locked in place. And so what that does is that starts to affect the tissue on the bottom of their foot that we call the fascia. And so what happens, you have all these different arches, on the bottom of your feet, and they act like shock absorbers or springs. So in other words, when you take a step, that bottom of your foot should have some give to absorb that impact of you walking or stepping, and then should come back and act as a spring to propel you forward. But when those bones all get stuck and the foot loses that movement and flexibility, now all of a sudden your foot is hard and rigid, and moving like this, and that starts to stretch and pull this plantar fascia. In particular, right about in this area, it starts to actually pull out of the bone and causes micro bleeding. That's what causes a lot of the pain in the feet, and that's why patients will tell you that they go to sleep at night and it starts to heal where that fascia is pulling out of the bone, and then they stand up and get up in the morning, and those first few steps they feel like Frankenstein is because that's actually pulling out of the bone again and it's starting that micro bleeding all over again. Same reason why if they sit for 2 or 3 hours and then go to get up and step, they'll have that same feeling and experience. Well, if you're trying to differentially diagnose if somebody has peripheral neuropathy versus do they actually have plantar fasciitis, there's usually 3 pain points that you can check. First of all, they're going to be very sore to the touch. It's going to be very painful when you press on that cuboid laterally there. And you want to tell the patient what you're looking for and where it's going to hurt before you actually demonstrate this or you test this on them. Remember, professionals predict the future, but you'll really have their attention if you tell them all the places it's going to hurt and then it actually hurts. Plus, you'll also have a lot of confidence that this is exactly the problem that they have. The other place they're going to be very painful is that talus is counter-rotated with their lateral sprain. They're going to be very sore to the touch on palpation on this medial aspect of the talus, and then you can go right under here and press right on the insertion point of that fascia, and that'll light them up and just about get them to jump out of their chair. And you just predicted the future. You've really got their attention, and we can show you how to treat this condition. In fact, do a test treatment that can have the patient feeling 80–90% better on their very first visit. And it's going to be very easy for them to pull out their wallet and their credit card and pay you for treatment for results that they already know that they're going to see and they're going to experience. We'd like to see you at our next boot camp. This is Dr. Rob Scranton.